Let's talk about IV gauges and their uses. Something to note is that the lower the number, the larger the IV bore. So looking at this chart, 16 gauge has a very large bore, where 24 gauge has a smaller bore. First is our itty bitty 24 gauge. This is used for our pediatric patients, our elderly patients, basically those patients with very fragile small veins. Next is our 22 gauge, which is used for IV fluids and medications. 20 gauge is used for IV fluids, medications, routine therapies. Sometimes a 20 gauge is used to administer blood, but this depends on the facility. Where an 18 gauge is used to administer blood, rapid infusions like boluses, and CT scans with IV dye. And lastly, we have our large needle of a 16 gauge. This is typically used for trauma, any types of surgery, and rapid fluid administration like boluses. Tell me in the comments, what IV gauge would you use on this vein? Happy studying, future nurses.